In this lecture, I will cover Alzheimer's disease, and Dr. Holliday will be covering traumatic brain injury. As you see, there are 2 YouTube videos listed below. Please write these down and review the video. We will also review this in class. Let's test your memory. I want you to put everything down and take a quick glimpse at this picture. Pay close attention because you will see these items again. Now, who can tell me everything you saw on the previous slide? Does any of this look familiar? Who can tell me what was missing from the first slide? Let's talk about Alzheimer's disease. It can be described as a type of dementia. Dementia is a progressive decline in cognitive function. Alzheimer's is diagnosed with brain imaging where plaques and tangles are seen. The cause of this breakdown in communication in brain pathways. So this causes breakdown in communication in the brain's actual pathways. At this time, there is no cure, but there are medications to slow the progression. There are some most common neurocognitive disorders, and what you need to know is that the risk will increase with age. Your mental health or psychiatric book describes 7 stages, and your med-surg book will list 3 stages of the disease. I'm going to ask that you be very familiar with the information that's found in your med-surgical book. Alzheimer's will progress from acute changes to more severe, which would include the loss of independence and mobility issues. Causes of death is seen in the late stage, and it is related to the complications of immobility. Some of the key features with the early, you're going to see short-term memory loss, mild and impaired cognition. With middle, you're going to see an impairment in all cognitive functions. The individual may be disoriented times 3, speech and language deficit, agitation, depression. With the late side, the client may be bedridden, dependent upon all ADLs, and unable to communicate. So, how does the definition of Alzheimer's relate to our concept of cognition? I'm going to ask that you refer to your med-surg book. I think chapter 39 goes over the changes in cognition where they're impaired. But we'll talk more about this in a class discussion. Who can tell me what exam may be used to test the onset as well as the severity? You may know this assessment tool as the mini mental status exam. It can be used to test the onset and severity. It can look at memory loss. Knowing with Alzheimer's, the individual can have behavior as well as personality changes and changes in communication as well as language deficits. So I'm going to briefly mention traumatic brain injury here, but again, your other instructor, Dr. Holliday, will be covering it more in depth. So let's talk about it briefly, and again, you'll get the more in-depth lecture in class. So who can tell me what is traumatic brain injury? It's damage to the brain from external force, and it's not caused by a neurodegenerative condition. It can lead to temporary or permanent cognitive impairment. You're going to see that there could be direct injury, and an example would be force to the head. For example, a football player hitting the head on the ground during a play that can cause a concussion. And then there's indirect, where there's a rebound effect from another part of the body. A forceful chest injury in a car accident causing rebound of the head. So again, you'll get more of this lecture, but just know that there are two types, mild as well as moderate and severe. So not two, but three, mild, moderate, and severe. So here we're going to discuss how does the definition of traumatic brain injury relates to our concept of cognition. So you'll see Alzheimer's and traumatic brain injury as two of our exemplars as we cover the concept cognition. Clients who experiences a traumatic brain injury will have cognitive impairment, and the severity is going to depend on the extent of the injury. So again, I just want to briefly mention the difference. And who can tell me the differences? What are some differences between the reason for impaired cognition? What are the differences in nursing interventions related to cognition? And Alzheimer's is caused by plaque and tangles in the brain, causing decreased communication in pathways. It cannot be cured. It's neurodegenerative. Traumatic brain injury can be caused by an injury to the brain. Areas that are responsible for intact cognitive status, some clients can regain cognition with appropriate therapies. It is not neurodegenerative. What about interventions? Most are the same. The difference is in the stage of Alzheimer's and the amount of injury that has occurred with the traumatic brain injury. Clients who have repeated head injuries are more likely to develop Alzheimer's. What information in the client's history would you expect to find related to Alzheimer's and dementia? I'll give you a moment to think about those. What about wandering, losing items, forgetting important information? You may see behavioral and personality changes as well. So although I'm recording this information, I'm going to encourage you to expand on your list because we will talk about this in class. What specific medications would the client possibly be prescribed? I know you're calling them out to yourself out loud, but I'm going to give you some classifications. And again, we'll talk more about specific meds in the actual classroom. But I think it will be to your advantage to be familiar with all of these. Cholinesterase inhibitors, N-methyl diaspartate receptor agonists, and SSRIs. So be familiar with those, okay? We are going to do a class activity, and we're going to look at psychiatric number 10, Rylane, and we're going to put you in small groups for this activity. So we will have some activities based on the information in the PowerPoint. But I do want you to review and be able to discuss how the nurse should respond to a client who refuses medications, to a client with aggressive behavior, and to a client that is wandering. So these links are located here. Be sure to jot these down or take a picture. Review these and be prepared to talk about them in class. This will conclude your brief lecture on Alzheimer's disease. We will have more discussion and class activities in class.